Hey guys, this is Jeff with Network Fitness. Today we're going over how you can get some better results for working on your forearms, especially if you're dealing with wrist issues. Whenever you do a lot of Oli lifting or you do a lot of handstands, those wrists might start hurting you. They don't recover quite as well. There's a series of stretches you can do where you're pulling your hand this way. You can use a box, put your hand down like this and straighten that arm. There's a lot of different things you can do as far as mobility for stretching and so on. You can also use a rumble roller or some of these other rollers or lacrosse balls with the bumps on and really dig in, work through those tissues, pulling that hand up. To make this process come along a bit faster, there's some things you can do with a compression strap where you're taking one of those rubber straps and wrapping around your lower arm and your hand to actually get that tissue to respond a bit better. So this video is to show how to do that. There are 4 different strengths of the strap. There's a yellow one, which is the lightest, then a green one, then the black one, and then an orange one. You want to make sure you use the right density of strap for your body. Some of you, this black strap is way too dense for your tissues in your hand and your lower arm. And it's going to feel like a vice on the bones there. You're not going to be able to move very well. That's working against you. So make sure you get the right density of strap for what your body needs. When you're putting these straps on, you are to some degree restricting blood flow. So you don't want to put too tight of a strap on here, but the idea is to put it on tight enough to where you can actually have it be effective. So we're going to put that strap across the hand first, and we're going to cinch this down by pulling that strap against itself. This can be a bit tricky to do to yourself because you don't have anyone else holding that strap for you. But you want to put that tight enough to where it holds on itself. Maybe get 2 or 3 wraps around here, and then come up across the back of the wrist, wrap around, do a couple of times around that wrist, and then go back across here. Now you can go across the front or the back of the wrist, either one, but the idea is to wrap a couple times, get it started, and then come back up across. And a couple times, and now I'm going to go ahead and tuck this in on itself. Now this strap is 80 inches long, which might be way too long for some of your arms. Some of you have much smaller wrists and arms than I do, so 80 inches is going to go around way too many times. So it might be a good idea to cut these straps in half if you have a smaller wrist and hand. But now I'm going to go through range of motion. I'm going to make a fist, I'm going to open my fist, I'm going to make a fist, I'm going to open my fist, I'm going to bend, both pulling my wrist in and out, I'm going to make a circle. Do any movements that seem natural with this on, even if it is putting pressure there on it this way, doing push-ups with it, whatever seems natural to you, whether you're going in, out, closing, opening. But when your hand is getting cold, it's time to take the darn thing off. You don't want to cut off circulation to the point where you do damage to these tissues. If you do have a sense of pain where it just hurts like hell, take it off immediately. Don't leave it on past that. This should be therapeutic. It should actually help things to work. When you do take it off, you should feel a flood of circulation through that area in a good way. This should feel better. It should never hurt. If it's painful, stop. If you're not a therapist, you may injure yourself by doing this the wrong way. If you have someone professionally working with you, let them do their job. They should know what to do as far as diagnosing and treating any area. If you're doing it to yourself, let your own sense of pain guide you. If you're on painkillers, stop. Don't do this ever if you're on painkillers, because you've got to be able to detect if it's helping you or hurting you. It should feel tight, it should feel restrictive, but it should not feel painful. Once you take it off, things should feel like, wow, I can actually move that better. There's like a fluidity with motion. That's what we're looking for. The tissue should respond better. When you come back in with this bumpy roller or a lacrosse ball or anything else, and you work into those tissues, they should be nowhere near as sensitive as they were before. We're trying to work in the muscle tissues, not so much the tissues at the joint itself. The ligaments and tendons that attach here, we don't want to damage those. Mainly try and keep your focus on the muscles. Even the muscles in the hands, you're working in the muscles here by getting in on those divots and working that in, but work on the muscle tissue, not so much the tendons and ligaments. You do that, you should have your wrist recovering better, should have things getting recovering faster after the workouts, and that we can train harder and get better results. Good luck.